Hi guys, Nate Rose, the Red Marine. I want to talk to you guys really quick about an issue that a lot of my clients recently have been dealing with, which is the sciatic nerve pain, okay? So the problem is we usually feel pain going up and down our leg or on one side or the other on our back. And we typically think, okay, my back is screwed up and that's why I have this pain. Now, if the pain is locally on one side of the body instead of just being right in the center of the back, like if it's more on the right side, like your right lower back or your left lower back, or going down your left leg or down your right leg, typically the back is not the problem. Usually it's tight muscles that you need to stretch and foam roll that I'm going to show you right now on how you can almost immediately, instantly get rid of that sciatic nerve pain. Because what happens is typically, especially if you're doing legs, which one of my clients has been doing recently with me, or you go for a run, or you sit for a long period of time, like you have a long drive and it's the holidays coming up, so we're going to be traveling a lot more, sitting down a lot longer than we typically do on a normal basis. And what happens is those muscles around in the hip area get pretty tight. And with those muscles in the hip area getting tight, what happens is it pinches on a muscle called the piriformis where the sciatic nerve runs through. And what happens is when that nerve runs through this muscle and it pinches and it gets super tight, this muscle pinches that nerve. And it sends pain either down the leg or up the back on one side or the other of the body. If that is the case, your back isn't the problem. Okay, the symptom is your sciatic nerve pain, but the problem is your piriformis is tight. You need to foam roll it and stretch it. And I'm going to show you how to do that right now to get rid of that pain almost immediately. Here we go. Okay, so let's say that our sciatic nerve pain is going down the right side of our leg, okay, or the right side of our back. So what we're going to do is we're going to focus on the right side of the body. Now the first thing you guys have to do is you've got to get a foam roller. Any foam roller will work when it comes to doing this movement that I'm going to show you. However, the one that I actually highly recommend is this one called the IntelliRoller. Okay, the IntelliRoll was designed by a chiropractor, and it's designed where you can actually use it on your spine, where the other foam rolls, it is definitely not recommended to use it on your spine, your neck, or your lower back. But because of this design, it's designed where it's a lot more versatile in what you can do with it. So I highly recommend you get the IntelliRoll. Now, you can get a discount on this if you go to the checkout on either IntelliRoll.com or anywhere and you type in Ripped Marine, you're going to get a 10% discount on that, okay? So I highly recommend you get a foam roll, and the IntelliRoll is the one that I use with my clients. So what we're going to do is we're going to take this IntelliRoll. This is going to be for the stretching, but I want to make sure it's on a hard surface. I'm going to sit my right piriformis, the butt muscle that actually is right here, okay? Right in this area, the upper glute area. I'm going to set that upper glute area on that middle of that foam roll, okay? I'm also going to take my right ankle, I'm going to put it on my left knee. I'm going to hold this with my left hand and I'm going to tilt a little bit. I'm going to do it from the side so you can see what I'm doing. So I'm putting my right piriformis, that upper glute muscle, on the foam roll. I can feel it already. I'm going to cross my right ankle on my left knee. That's going to give it a stretch. I'm going to hold my ankle on there with my left hand. My right hand's back behind me for support. And I'm just going to roll forward and back, until I find a knot. And that knot, if you have sciatic nerve pain, you're going to feel it. You're going to incredibly feel it. It might even make you jump through the ceiling, okay? It's going to be that painful if you have that kind of pain. And once you find that knot, is you want to kind of just sit on it. Maybe kind of roll forward and back or side to side. And you'll notice that as you start moving around, the pain might be a little bit less in certain areas. You want to go where it has the most pain, okay? You want to try to make yourself a little bit uncomfortable to try to work out that knot. What this is called self-myofascial release. You don't really need to know that. It's SMR for short, okay? Self-myofascial, the muscle release. You're doing yourself a self-massage, but very particularly in this area to get rid of your sciatic nerve pain. You can also do this with a straight leg. Keep your leg straight, but you've got to get that upper glute area, so you want to kind of roll over it, and I can feel me rolling over a little knot right now, okay? That's actually massaging out that knot that is pinching that nerve on that sciatic nerve, okay? Let's say it's the left back, okay? The left side of the back. So I'm gonna do the same thing on the left side here. I'm gonna put my left glute muscle, okay, on the foam roll. I'm gonna cross my left ankle on my right knee. Notice my hands behind me for support. I'm not all the way sitting up here, it's down. I'm rolling down to where it's getting the upper part of the glute muscle, not the middle, not the bottom. The upper glute muscle, and I'm gonna lean to the left, okay, until I find that knot. When you find the tender spot, that's what you want to hit. And that nerve is actually going right through that muscle. You'll know it when you find it. And if you don't feel anything, just keep rolling around or adjusting your body until you feel it. If you have sciatic nerve pain, trust me, you will feel it instantly. Now what you want to do is you want to massage this area for a few minutes, okay? Let's say about 30 seconds, okay? And then kind of ease off it for a little bit. Do about 3 to 5 minutes of the foam rolling technique, okay? You're trying to work in that muscle, basically kind of like you're digging an elbow in there. You can use a golf ball, you can use a softball, a baseball, any kind of hard ball. Tennis ball will work too, but typically the harder balls that won't cave in get a little bit better. It's more of a trigger point, but this one is a lot more versatile and you can do a lot more with it. That's why I recommend using the foam roll. Now, you can also get your hips, okay, the front part of your hip. If your hip flexors are really tight and cranking on your hips, that will get it too. But I just want to focus on stretching out and massaging out the foam roll. That's going to get rid of that sciatic nerve pain. So after we're done with this, we're going to do a few stretches, very specific to help stretch out that piriformis. The first one's going to be the cross-body hip stretch. Okay, let me make sure the camera's getting me here. Okay, it is. Good. All right, so we're going to lay down on the back. Okay, all the way down on the back. We're going to get that right side again. So I'm going to bring my right leg up. I'm going to take my left hand, put it on my knee. I'm going to pull my knee down towards the floor, stretching out this hip glute area and trying to keep this shoulder, right shoulder blade on the ground. Okay, it's going to really open up the hip and stretch out that lower back. If you have the back pain, trust me, you are going to feel this stretch big time. Don't worry about if your arm comes up, that's all right. Your goal is to try to stretch out the hip area. So focus on this area as you're stretching. You're going to feel a good stretch on your lower back and your hip. Do both sides. Adjust your hips. Make sure you're straight. This leg goes straight. Bend this knee 90 degrees. Take your right hand on the side of your leg and pull it across your body. Stretch out that left butt, glute, hip, low back area. Okay? The next one we're going to do is called the half pigeon stretch. Well, let's start with the 90-90 stretch first, and then we'll go into the half pigeon. So we're going to go 90 degree bend at the knee here with the right leg. Okay, I'm going to sit on my right butt. I'm going to take my left leg, I'm going to put it back, 90 degree bend at that knee. I'm going to flex this foot. See, I'm off to the side, right? What I want to try to do is center my body so it's right over, my chest is right over this leg. And I'm just going to lay down and try to put my elbows on the floor. I'm telling you, this right here, already I'm feeling a huge stretch in my glute piriformis area. Some of you may not feel a stretch doing this movement. That's okay. You might be off to the side. Try to center yourself and then come forward. Then you might feel a stretch. Now, if you don't and you're flexible enough, what you're going to do is called the half pigeon, okay? I'm going to take this leg in. I'm going to point this like an arrowhead straight forward. I'm going to kick this leg back, and I'm trying to lay on top of this leg. Now, this stretch right here, this is going to get your piriformis. If it doesn't, take this left arm and try to put that shoulder on the ground. Okay, because now we're really stretching out that piriformis glute area. And if you don't feel it, just kind of keep moving your body around until, like right there, I feel the stretch more. So I want to hold this for at least a good 20 to 30 seconds. All right, to kind of release that muscle and release that tension in that muscle that's cranking on a nerve. Now, same thing with the left leg. All right, I'm going to go half pigeon this time, just right into the extreme stretch one. Here, leg back. And this side's a little bit tighter, I can't go as low. Right there, I already feel the stretch, okay? And that's getting that left upper glute area on the piriformis. And you're going to find that one side is a little bit more unflexible, a little bit tighter than the other. And make sure that you're stretching that out. You want to try to balance your body out as much as you can. Now, the last one that you can do on the piriformis as we're going to lay down on the back. I'm going to go sideways so you guys can see this one. I'm going to cross my right ankle on my left knee. Okay, I'm laying down on my back. I'm going to reach through my legs and grab my hamstring. You can also take a towel and put a towel through your leg, and you're going to pull your knee into your chest, trying to keep your hips and your lower back pushed into the ground. That's going to stretch this right glute. Okay, I'm going to flex the foot, I'm going to pull it in, relax my head, and pull that leg to the chest. Try to push that elbow into that knee so you're getting that good stretch. This one's laying down on the ground. Now, if you don't have the strength to pull and you still don't feel the stretch, what you can do is put this foot up on the wall, put this foot on the wall for the support, cross this ankle, and you're going to scoot your butt closer to the wall, pushing yourself down into the floor, and you're going to feel a really huge stretch on that piriformis. So, once again, if you have pain that's going down one leg or up the back on one side, typically it's the piriformis that's causing that. You're going to have and think that you have low back pain and your low back is jacked up, and it's because it's being caused with sciatic nerve. But that's not the problem. The symptom, of course, is back pain, but the problem is your piriformis. You just got to foam roll and stretch. Grab the IntelliRoll, okay? Get the discount code with Ripped Marine. Type that in when you check out. You'll get 10% off. Get the foam roll, and then there's videos on the website that go over how to use it for every part of the body. But I'm telling you, if you massage out the piriformis and you stretch the piriformis, if this is the problem, your sciatic nerve pain is going to be gone. You're not going to have to go to the chiropractor and get all these adjustments. Now, you probably might need a chiropractor to get realigned. I'm not saying don't do that. I go to the chiropractor. I highly recommend them. What I'm saying is the problem is your piriformis, your tight muscles from working out or from running or just sitting for an extended period of time. You foam roll those and stretch them, and your pain's going to go away like that. Right, Nate Rose, the Ripped Marine. I hope this helped you out. And leave some comments, and have a great day. Be strong, fit, and ripped.